The NFL says concussions fell 25% this past season. There were 111 during the regular season. That was down from 148 the previous year. Diagnosing concussions can be difficult, but tonight, Dr. Jon LaPook tells us there's a new method.
51-year-old Dirk Kaufman was riding his bike last March when he was hit by a car. He wound up in the emergency room at Bellevue Hospital.
What was the first thing you thought when you woke up?
What the hell happened?
What happened was a concussion with memory loss and confusion. In Kaufman's case, the injury did not show up on a CAT scan. But less obvious cases of concussion are harder to diagnose, says neurosurgeon Dr. Uzma Samadani.
Concussion actually has 43 different definitions, and that's part of the problem, is that nobody knows how to define it, and therefore nobody knows how to diagnose it or count the incidence of it.
One more time around.
Samadani and her team at NYU's Cone Veterans Center are developing a way to diagnose concussion by measuring how the eyes track a moving image, in this case, an animated movie clip. 97% of healthy people move their eyes together at a very predictable rate. Today's study found emergency room patients with symptoms of concussion had problems with eye tracking, even when their CAT scans showed no evidence of brain injury. The study also found the more severe the symptoms, the more abnormal the tracking.
Haven't cartoonists known that for years, that if you get bonked on the head,
Yes.
they draw the characters, their eyes are going this way or that way?
Yes, so Wile E. Coyote is the classic example of the cartoon character who gets hit on the head and has abnormal eye movements, and that's how you sort of diagnose concussion in the 1950s when Wile E. Coyote was created.
One problem is injured athletes can downplay symptoms in order to keep playing.
I think this is really important, that there's an objective measure. You can't fake whether or not your eyes can move together. If someone has a brain injury, you're going to be able to detect it.
Fortunately, Kaufman's eye tracking returned to normal in about 2 weeks. Dr. Samadani has submitted patents for this experimental technology and is part owner of a company that holds the license.
Thanks very much, John.